Hi, everybody. It's me. It's Dr. Kessler from Lorain County Community College, and welcome to today's co-video. Um, Wearing a mask today because it's a very good idea to wear a mask, especially right now. All right, let's begin. First of all, I want to talk about my temperature. It is 97.2 degrees Fahrenheit. This is a measure that we can use to detect whether we have an infection going on. I think we don't need to mention that very much anymore, but it is an important thing. There are some things that we can do going into where we are right now, and I just want to make you all aware of how we can help in the situation we're in right now, and we're in the biggest part of the epidemic. First of all, I think you all at this point know that there are 43 counties in Ohio, and certainly there are a lot of places all over the country that are experiencing a tremendous amount of virus. There's virus spreading throughout the country, and there is things that we can do. This is not a hopeless thing. This is a something that we can do. This is a very important part. I just want to point this out of things that we can do to help everybody else out in this situation. All right. So we in Ohio are having an upsurgence. There is, we are seeing much more cases. The death rate is this is just measuring a 1 day difference here, so it's not terribly big of a difference. But over the last 14 days, we've seen tremendous amount of increase in deaths, an increase in hospitalization. The hospitals are filling up. My students are telling me about that. We are seeing cases everywhere, and it is not just us; it is the nation. What you can see from here is that pretty much there is a wall of infections going on from Wisconsin through Illinois. That's the big half, the upper half of the west of the Midwest is a wall of infection with a lot of cases out there as you go further. This is, of course, of the outbreaks that we've had. This is the biggest peak here. Number of cases we have that we're experiencing right now in the country. Now, um, one of the things I want to point out is that we are seeing some states go back, where some states going forward. We don't necessarily need to go back into reversing. There are some states that are. Illinois is probably a good idea. Wisconsin probably should be reversing. New York is also reversing, but that in and of itself, I think that they can manage that a little bit differently than they are. But that's neither here nor there. So we have a difference for example, in Ohio, where we're reopening, and New York is reversing. You can see in Ohio, we are we have the most cases we've ever had, and in New York, it seems the opposite is true. They have the lowest number, and they see a small increase. So I'm not sure New York. I think New York is probably doing too much, and we are doing too little in the Midwest. And again, this it's really up to us to if the governor says to do something, people don't necessarily do it. So it's really up to personal responsibility. There's a personal responsibility that we all have to each other because we are in the season of the virus. Viruses like winter. They like the season when people are inside. They like to be where and they spread around better. We are, in fact, seeing more cases of the virus being spread in households as we speak. Um, One of the things that we noticed is that in Wisconsin, for example, this report came out a few weeks ago in Wisconsin, showing that people were not we're not responding very in a very concerted way. There were kind of sporadic um, advices going out there to people in Wisconsin, and so there were a lot of young people who were really responsible for spreading the infection. And you can see that Wisconsin is paying the price of that. So even though young people don't necessarily get the severe forms of the disease, others will suffer based on these large spreading activities that go on. So we need to be very, very cognizant about bringing that down. Wisconsin, of course, is red all over right now with cases. Um, so one of the things that we have learned is that household contacts or exposure to people for long periods of time is a problem, or even short periods of time. We've actually seen a couple of cases where it's been quite short. The what we should do going forward to protect others and ourselves is this: as soon as you become positive, and I'm going to just assume that you will, that is the time that you want to self quarantine right away and take the whole family with you. So all your household, everybody gets quarantined, and everybody should be wearing masks within the house to slow the exposure down in the home. I have heard lots of cases. I know lots of people who've had COVID-19 in a house, and not everybody gets it. And then I've known other households where everybody gets it. So both of those scenarios are possible. If we can slow it down or keep it from spreading from one person to another, that of course would be a really good thing. We have when we look at the pandemic we're in right now, I have to tell you that the best information you can get about a pandemic come from 1918. In 1918, that is when we got all kinds of information. And if you look at the data, and this group has, this is from 2000, this is a paper from 2007. They went back and looked at all of the data from 1918 and 1919, and they came up with the following conclusion, and that is that early, sustained, layered application of precautions were responsible for having a better situation. That's what you want to do. Early action, sustained, and layer it in when you have to. Be very, very careful. Wear this mask. This mask is amazing what it can do. And even if it's not, it won't hurt you. I just want to point that out. There is no evidence that wearing a mask actually hurts you. That's internet stuff that says that it will hurt you. So one of the modeling that has been done by a very good group out in Seattle, and they have looked at some modeling, and they estimate that if we go up to 95% masking, that we can save like 100,000, 133,000 lives. I mean, that is tremendous. So think about that. Think about washing your hands a lot too, and making sure that your hands don't get too dry from all the washing that's going on. Like I say, we're entering into a rather difficult period right now, and we have to be very careful about how we move forward. I also want to give advice for people who are thinking of getting together with family at Thanksgiving. Yes, there are ways that you can get together safely with family at Thanksgiving. One thing that you can do is just be very cautious about your behavior in the weeks preceding Thanksgiving. If you can kind of self-isolate yourself, quarantine yourself, and just think about one thing today. Think about one thing that you can do that is a little bit more, that you can do without having to go too much out of your way. I don't want you to change your lifestyle dramatically. Nobody wants you to bury yourself, under a ground to protect yourself from this virus. But do something a little bit more. Like maybe wash your hands a little bit more. Maybe think about, the distance that you have with people. And we will get through this. This I know. I know this because I've been studying diseases my entire life. We will get through this. And hopefully we'll get through it quite well. May you all persist like a lentivirus. May you all be good to each other. Find the helpers. They wear masks. The helpers wear masks, it turns out. As it turns out, they wear masks. So look for the people who are out there helping, and be nice to the people who are not helping, because you don't want to create more difficulty. Just stay away from them. Stay away from the people. Be safe, everybody, and we will all get through this. Thank you, and have a good day.